I'm Laurie Edmiston, Executive Director of CATI, Canada's source for HIV and hepatitis C information.
And I'm Suzanne Nicolay, outgoing Chair of CATI's Board of Directors.
This past year has been marked by many losses, globally, nationally, at our local communities, and also here at CATI. In the past few months, we've been heartbroken by the loss of Zach Knowles, a CATI colleague of ours for the past dozen years. Zach was caring, conscientious, had a great sense of humor, did a wonderful job here at CATI, most recently as the Associate Director of Online and Print Publications.
The CATI board was also saddened by the passing of one of our former members, Marcy Summers, a longtime advocate for people living with HIV, particularly women.
In the past year, our work has been dominated by the COVID-19 pandemic, the worsening overdose crisis, and the ongoing epidemics of HIV and hepatitis C. But we've also experienced incredible strength in the face of this adversity. We'd like to share with you some of the highlights of how CATI has addressed these challenges and showcase the good works of many of our community partners who have creatively and courageously adjusted their service delivery models over the past fiscal year 2020 and 2021.
As a nurse, I know all too well the challenges that frontline service providers have been facing: the COVID-19 pandemic, a worsening overdose crisis, and epidemics of HIV and hepatitis C that continue unabated.
CATI exists to support frontline service providers, and we've been adapting to meet your needs every step of the way.
At the beginning of 2020, Canada was making progress towards our goal of eliminating HIV and hepatitis C as public health threats by 2030. One of the 90-90-90 targets for HIV elimination had been achieved. A modeling study predicted that Canada was on track to eliminating hepatitis C. Then, the COVID-19 pandemic changed everything. Most health and social service providers had to radically alter the way they deliver services. Some had to deliver services online. Some had to reduce the number of people they could serve at a time. Some had to close their in-person services entirely. While trying to manage a surging COVID-19 pandemic among the populations they serve, service providers were also trying to sustain their HIV and hepatitis C programs under a new reality. CATI immediately stepped into action. We delivered webinars with more than 3,700 attendees. We organized online workshops with nearly 1,000 participants. We produced educational videos, web pages, and an issue of Treatment Update on COVID-19, with information tailored to communities affected by HIV and hepatitis C. Our website reached more than 3 million people over the past year. We also adapted our HIV and hepatitis C work to the new reality. Our education work with service providers went 100% online, including a new course on HIV treatment. More than 3,000 individuals completed a CATI course over the past year, either self-directed or facilitated by an educator. Our immigrant and newcomer hepatitis C education work, funded by the Ontario Ministry of Health, also shifted online through virtual meetings, educational videos, and ethnic media advertising. With last year's approval of HIV self-testing in Canada, we knew that this would be an important additional tool for reaching the undiagnosed during the COVID-19 pandemic. We created a suite of updated HIV testing information resources for service providers and their clients, and upgraded the HIV411.ca directory to serve as a linkage to care service for people who get tested at home. We published more case studies and articles on models of effective HIV and hepatitis C programs. And in response to a burgeoning overdose crisis, we profiled more harm reduction and overdose prevention programs. We hosted webinars for service providers to share strategies for adapting programs to the remote context and how to sustain the HIV and hepatitis C response during the COVID-19 pandemic. We adopted a multimedia approach for new information resources, with videos to accompany print and web publications on post-exposure prophylaxis and HIV testing. We updated our collection of resources with the latest HIV and hepatitis C science, and published a new issue of The Positive Side, our health and wellness magazine for people living with HIV, nominated for a National Magazine Award this year. Of course, none of this would have been possible without the leadership of our board of directors and the dedication of our staff, all of whom are working remotely and have quickly adapted to meet the needs of the service providers we work with. We are also grateful to our funders, the Public Health Agency of Canada, the Ontario Ministry of Health, AbbVie, Gilead Sciences Canada, Merck and ViiV Healthcare, along with in-kind contributions from IMD and Chappelle. To view our full financial statements, visit our website at www.kati.ca.
I'm looking forward to seeing all of you again, hopefully in person, once we've achieved universal and equitable access to COVID-19 vaccines, and we can redouble our efforts to eliminate HIV and hepatitis C as public health threats.